Now, the Health Minister, Stephen Donnelly, has agreed to meet doctors representing National Gender Service over concerns about the HSE's ongoing use of the UK-based Tavistock Clinic for Irish children dealing with gender identity issues. For more on this story, we're joined by Mark Tighe, reporter from the Sunday Independent. Mark, you were writing about this yesterday. Just give us the backdrop to this this letter going to Stephen Donnelly and his agreement to meet those four doctors.
Hi Shane. Yeah, so last Thursday on foot of the report that we did in Sunday Independent, where Dr. Paul Moran, who's a consultant psychiatrist, had outlined his concerns about Ireland's use of the Tavistock Clinic. He was saying that he felt that they had this kind of modus operandi of pushing kids, this is under 16s, that go to Tavistock, into taking puberty blockers and hormones, and that they were basically pushed into this kind of road of transitioning when other issues that they have were being overshadowed. There's been mental health or social issues, and he's been warning of this since 2019, saying, we're going to have a wave of people when they grow up, they'll have regret about transitioning because their other mental health issues or social issues haven't been addressed by the way Tavistock is running. And some of the criticisms he's had since 2019 have been stood up really by the Hilary Cass report, which came out in the UK in March, which talked about the same issues about clinicians being pressured to go down only one route and other issues being overshadowed. So last week on your own show, on RTE, initially Siobhan New Green, a senior doctor with the HSE, said, no, we're going to continue to use Tavistock Clinic. We don't see an issue there, and it'll remain open until early next year. And on foot of that, so four doctors in Ireland's National Gender Service, which deals with adult patients, wrote to Stephen Donnelly on Thursday, and I believe they also privately contacted him as well at the same time, just given the urgency of their concerns. And even though the minister is away on leave, he responds straight away, said, yes, as soon as I'm back, we'll set up a meeting and we need to discuss this.
Okay. There was also, and you wrote about this yesterday as well, one of those who wrote the letter to the minister carried out an audit of 18 patients treated by Tavistock. Tell us about that audit.
Yeah, so this is an audit done in 2019 of the first kind of 18 patients who aged into the National Gender Services age cohort. So these were patients who were 17, 18 who had already been treated by Tavistock. And Ian Schneider, one of the doctors that signed this letter, had done an audit on them. And so this showed that basically there was a complete lack of reports done. I think only 7 of them had the reports. So this is what basically these reports are assessments, and they show the doctors, well, here's why they're on a certain treatment. Here's why they're on puberty blockers. So when the doctors in Dublin were getting these patients, they wanted to know, obviously, why require you on those hormones. And so in nearly half the cases, they weren't able to tell why they're on that level of treatment. I spoke to Dr. Moran about this audit, and he was telling me out of those 18, they've kind of done a checkup on them. 10 are continuing to be treated now, who are on hormones or puberty blockers. 1 has desisted, so they haven't gone through with they come back to their original gender, and of the rest, then some of them are still on waiting lists, some of them are still being assessed, and some aren't contactable. But the major thing out of that was nearly every single one of the patients had serious comorbidities. These are other medical issues which didn't seem to be being addressed by their treatment under the Tavistock regime. So this is kind of an example of the type of patients they were seeing.
Okay, just before I let you go, you've been writing about this issue now for a number of weeks. Are you surprised at the lack of reaction from opposition politicians on this, and even government politicians on this issue?
Yeah, I suppose I am, because there's a serious concern here, and the future of gender identity services is really up for grabs here. There's two kind of different ideologies on this. One that says let's bring them in, assess all these patients and see what needs to be done. The other is saying, no, let's affirm what they want and let's get them on puberty blockers as soon as possible. Let's get them treated by hormones. I know, like someone like Paul Murphy, who's quite an outspoken TD from the People Before Profit, he labelled our coverage transphobic. Myself, I've been attacked by the TENI, who are a transgender support group, as being weird and obsessive. So I know I know a lot of senior politicians on both government side and on the opposition side do have concerns about the way, the ideology behind our current system. But they're afraid to speak out because they're afraid of being labelled a TERF or transphobic. And I'm talking about people who are on the left and on the right who do have concerns about this. Like, no one can say that Paul Moran, who, as he talked about in our coverage at the weekend, he helps people transition, when that's clearly the best thing for them, and that's the medically it's all sound. But where there's other issues, he wants to have those things treated.
Okay.
But just even providing coverage on that, we're labelled transphobic, and so you can understand politicians who just don't want to have themselves made a target.
Okay, Mark Tighe, reporter from the Sunday Independent. Thank you for talking to News Talk Breakfast this morning.